When I'm back into practice, I get involved quite a lot in issues around breeding. It's not always plain sailing. It can be an absolute joy, but sometimes things don't go quite according to plan. And we get called upon at all hours of day and night. It begins when the bitch begins to whelp, and it depends on the level of experience of the owner, but people will start to worry when things are taking too long. And it's important to get in touch with your vet in good time if you think things aren't working out the way they should. Probably worth mentioning at this stage that you need to know where your vet is, and if it's not during normal working hours, it may not be in the surgery that you usually attend, and it may be some distance away. You've got to factor that time in. If it's going to take you 25 minutes to drive to an emergency centre, that's another 25 minutes you've got to allow the dog to go on without the veterinary intervention. So bitch starts having puppies, and very often it's pretty well plain sailing. But we do get problems where puppies don't come out, and they don't come out for all sorts of different reasons. Sometimes the bitch is just unable to push enough. We have a condition called inertia where nothing much seems to happen. I think that really happens most when they've got lots of puppies inside them. But we get puppies that are too large, or the dog may be too fat. Unfortunately, if we get the bitch too fat, there's a smaller space for puppies to come out. And at the same time, if the bitch is too fat, the puppies are going to have been really well fed, so they're enormous as well. So you get a combination problem there. And we'll get puppies that come down through the birth canal, and they're just not in the right position, and they get their head twisted back, or they get their legs twisted back, and they're just too wide to emerge. And the bitch will push and try and get nowhere. Probably one of the cardinal signs of that is a green discharge appearing from the vulva without any puppies, because that normally comes out when the puppies are delivered. It comes from the placentas as they separate inside the dog, and if that green discharge starts coming out and no puppies, the alarm bells really should start to ring. And as I say, you've got your phone number of your emergency vet to hand, you know exactly where you're going to go, everything's prepared. We even get people ringing us up in the evening and telling us the bitch is due to whelp tonight, and just giving us a bit of a heads up that there may be a call coming in, so that the vet can just be ready for it. So we will examine those dogs if they're having any difficulties, and we can x-ray them, we can scan them, we can make an assessment of what is the likelihood that these dogs are going to be able to deliver these puppies. And if we think it's a reasonable option, then we can give them drugs that are going to make it easier for them and perhaps make them push a little harder. That's pretty often successful. But if it's not, we might have to make a very quick decision about doing a cesarean section. Now, you've got to plan for that. There's an expense involved, obviously. It could be late at night. So have some thought about that. What will you do if things do go wrong from a financial point of view? It's got to be thought about. But we will often do cesareans, any time of day. And although it's a very complex procedure and not to be taken lightly, then with experience, it's often quite successful. So if we get those puppies delivered, either naturally or by cesarean, it's not entirely over at that point. There's another few weeks then when things can go wrong. Probably the thing we see reasonably often is mastitis. So you'll get an infection in the mammary gland where the milk is, so the gland becomes infected, and it will very soon become really hard and hot and painful. You wouldn't miss it, because that dog's going to become really poorly really quick. And it's important we get on top of that as soon as possible. So if you even think that's happening, get your dog checked out. We can tell the difference between mastitis and just swollen mammary glands, but only if we feel them. We can't do it over the phone. So if we don't get mastitis, dog's feeding the puppies lovely, but if it's got a good big litter, it's going to be delivering loads and loads of milk to those puppies, and that takes a lot of calcium. And if the dog's calcium levels start to drop too low, dogs are really, really sensitive to their blood calcium levels. That gets too low, they're going to suddenly hit a wall, and they're going to start to shake and twitch and even have seizures, and that's called eclampsia. Most often is going to be at 3 or 4 weeks into feeding. But I've seen it within a matter of days of whelping as well, so you've got to watch out for it all the time. If your dog shows any signs of twitching, unsteadiness, excessive nervousness, get some advice, because a quick blood test will tell you where that calcium level is, and if it's low, we need to supplement that right away. It's relatively easy to put right, but if you miss it, it can be really dangerous. So you've got a period there of leading up to whelping, through to through to weaning really, when you've got to be pretty vigilant, to keep an eye on things. And keep your vet involved, keep us in the conversation, and we'll guide you through it as best we can.